As a traumatologist, I'm really interested in prevention strategies. My goal is to really put myself out of practice. If I can prevent people from falling within their own homes, I feel like I've made an impact in people's lives. In particular, I'm most worried about my patients who have an injury or a broken bone and then go back to their home environment where they fell by themselves, and finding unique ways to build that bridge is really important. With this in mind, my twin sister is a physical therapy researcher, and after many discussions, we really have this concept of, we know that there's many ways to prevent falls. There's lots and lots of research to say we're successful, but there's a huge gap in how we implement that for patients. We've been able to meet and work with some incredibly inspiring paramedics locally. And with that collaboration, we've learned from each other. We get to hear the lens that they see every day, and they get to hear our lens, and we've even walked each other's shoes. And with that, it's really helped us understand what the barriers are to implementation of fall risks within homes. In particular, getting grab bars in places that are frequent areas of falling, making sure that rugs are taken out of the home that are barriers for navigation, and all kinds of other risks to what we call age in place safely. While we talk about it in our clinical environment, I never have the eyes and ears to the home. And what's interesting is our paramedics do. They're this unique lens to the healthcare system that we never see. So we're working really hard to figure out how we can help create new implementation strategies. And we've been very fortunate to have foundational funds as well as government funds to help build a unique paradigm of care where we're working with the paramedics to bridge that gap, to do intervention in the home upon noticing it, rather than trying to seek out resources and connecting resources. We're trying to bridge that gap immediately and just making it happen through implementation. The other unique thing that I've learned in this process is it's not so much that sometimes people can't afford a grab bar, it's the decision making about it. You go to Amazon and you Google grab bar, you're gonna get 1,000 hits. Which one's the right one? Where do you put it? Do I get a consult from a handy person to come out and what are they gonna say? And then I have to pay in addition for them to install it, which can be $500 to $700, in addition to the cost of the grab bar. I think these are the barriers that we really have to understand as we move forward in our research, because we have great solutions. It's the implementation gap that we really need to focus on the next few years.